Hey, Dad.
I'm not feeling very well.
What do you got going on?
My chest is really hurting, coughing a lot. I just don't feel right.
Well, maybe we should go see Dr. Butt Dog.
Alright, let's go see Doc.
Thanks, Dad. Anything for you, son.
Yeah, Dad, I'll let you know what Doc says. Hey, Doc.
Oh, hey Nick, what's up?
You know, I've been feeling very well lately. I have a lot of congestion in my chest area, trouble breathing, coughing a lot of phlegms coming up. Dad said come in to see you, so.
All right, so let's go take you, go run some tests, and we'll see what's wrong with you.
All right, which way are we going?
We're gonna go that way. Follow me.
Whatever you say, Doc.
Hello, Nick. I've got the results of your tests here.
All right.
It appears that you have an upper respiratory infection.
That's not good.
No, it's not. It's not at all. So we're gonna prescribe you erythromycin to help treat for this upper respiratory infection.
All right. Tell me a little bit about this.
Erythromycin you're going to take it orally with food, okay?
All right.
It can be administered through IV or as a topical cream, ointment,
But I'm going to be taking it as.
but I prefer you to take it orally with food.
All right. Roger that.
You're going to be taking it 500 milligrams of it every 12 hours. I could give you 200 milligrams every 6 hours, but I think the 500 is going to be a better route. And if you were a young child, I would give you 30 to 50 milligrams per day in intervals.
All right.
It's classified as a macrolide antibiotic. Z-Max and Vioxin are two examples of macrolide antibiotics. The mechanism of action for erythromycin is that it inhibits bacterial protein synthesis.
The mechanism of action inhibits bacterial protein synthesis by binding to bacterial 50S ribosomal subunits. Binding inhibits peptidyltransferase activity and interferes with translocation of amino acids during translation and assembly of proteins.
So wait, Doc, I got a question.
Yes, Nick?
What are drugs such as erythromycin? When are they used?
Well, erythromycin is used when to treat infections and prevent people from having infections.
All right.
That's what we call an indication for use.
That would be in my case, correct?
Yes.
Awesome.
And the times we don't use erythromycin are when people are hypersensitive to erythromycin, they have a fructose intolerance, they have a glucose-galactose malabsorption problems, or surcase isomaltase problems. Do you have any of these conditions or problems?
I have none of those, luckily. But what are the side effects that I could experience through this drug?
I can tell you some of those. Some of the side effects and adverse effects of this drug are anaphylaxis, deafness, diarrhea, cardiac arrhythmia, but that's a rare side effect.
All right, good. That's bad.
Nausea and vomiting, and abdominal discomfort.
Superinfections including pseudomembranous colitis have been occasionally reported to occur in association with erythromycin therapy. Pancreatitis, liver, and skin issues have also been reported.
So Nick, are you currently on any other medications?
I'm not on any drugs at the time, no.
That's good, because this drug interacts with a whole bunch of other drugs, such as estimazole, mesopride, and mesolastine.
All right.
Now I'm going to give you a packet that's going to explain everything you need to know about this drug. It's going to have all the side effects on it and every drug that it interacts with, okay?
Okay.
It's also going to have some trade names and some generic names on here.
Okay.
And I'm going to give you your medication.
Okay.
Here you go.
Thank
Like
you.
I said, take orally with food.
Okay.
Take 500 milligrams every 12 hours, okay?
And it says it right here, right, Doc?
Yes, that's right. Right there.
Awesome.
And all the information you need is in that package, just like I said.
Thank you, Doc.
You're welcome. If you have any problems, just call me.
Yep, I'll have my dad set up an appointment too.
Yes.
See you in a couple weeks.
Yes.
All right. Thanks, Doc.
Thank you, Nick. For all you healthcare providers out there, you need to be aware of the herbs and medicines that your patient is taking, because it will increase the likelihood of adverse effects due to the fact that it is excreted much more slowly. You need to make sure the patients know to take it orally with 6 to 8 ounces of water and food every day, and IVs can be given without regards to food. Some other fun facts for you. Pregnancy. You can't give it to anybody that's pregnant because it crosses the placental barrier and it is excreted in breast milk. So don't breastfeed while you're on this. It's used less often due to the antimicrobial resistance. It is known as the grandfather drug in this category, and it's used quite often 20 years ago.